North Texas summers can be tough for people with breathing problems like COPD and asthma. Medications help, but many people with chronic lung problems have to stay indoors much of the summer. Dr. Bill Johnson of Innovations Medical is here to talk about how stem cell from your own fat can help with your breathing problems. Good morning.
Good morning.
I shared with you I grew up with asthma, and so I can truly empathize for people who are struggling this summer. But why is it that summer can be such a tough time for these people?
Summer really is a tough time because we run our air conditioners, ozone levels get up high. Dallas had the dubious honor of being the most polluted city in Texas in 2016. We've done a little bit better the last couple of years. We've dropped. We're now less than Houston, but still, in the summertime, it can make it really tough for people with reactive airway disease that get irritation in their lungs from the ozone and other pollutants, and that really makes it tough for them to breathe.
Well, why is it that the air quality affects your breathing?
Well, we're going to use these balloons to kind of demonstrate what's going on with both COPD, chronic obstructive lung disease, or pulmonary disease, and asthma. Normally our lungs, this is the relaxed state, they're deflated. So it's active when we use our muscles to breathe. So we breathe in, we fill up the balloon.
We inhale.
Now, the problem with COPD and asthma is normally the air just flows out freely, okay? But with COPD and asthma, what happens is the area is partially obstructed, and so they can't get it out, just like this, okay?
And that's what
so
causes the
air gets
breathing.
trapped, they feel like they
wheezing.
can't breathe, okay? And the reason they feel like they can't get it in is there's so much in and they can't get this out.
Oh, okay, this makes sense, and I'm learning a lot, right? You actually taught me a lot about with the asthma that I had. So then how does stem cells work to help the obstruction of the airflow?
Well, we don't know everything that's going on, and that's important to understand, but one thing we do know is that the stem cells are very highly anti-inflammatory. So all the mucus and spasm and problems that build up, the stem cells help to relieve so that now they can get the air out a lot more easily, okay? So that's that's a big part of what's happening. There may also be some other things happening with not only with inflammation, but with some healing going on inside the lungs, but we don't have a lot of studies to help confirm that yet.
What kind of results are you seeing?
Well, about 2/3 of COPD patients are seeing improvements, about 3/4 of asthma patients, and about 80% of patients with pulmonary fibrosis, which is a really good one. What we're seeing, you can see on the graph, this has been really exciting. It's a very small group right now, but when you're diagnosed with COPD, from the time you're diagnosed until you die, you lose about 1% of lung function per month. Nothing has been able to reverse that, but with the stem cells, we're seeing a very slow reversal, where instead of continuing to get worse, they get better by about 0.5% a month. That's not much, it's very slow, but
it's a change.
It's a change. It's going the other direction, and there's not been a previous treatment that could do that.
That's incredible, Dr. Johnson. That is amazing. I love when we get to talk about this. You teach me so much. But also, I want to make sure that everybody knows about your brand new website.
Right. We have a brand new website. We've combined the cosmetic and stem cell websites so they can all go to one place, innovationsmedical.com. We're building a lot of new information on it, so it's got a lot of data. Where we are, if it's not already up, it may be this morning. We have a lot of the results data on the stem cells, which has not been available previously. Okay,
so if this is something that you are interested in or you have some questions about, definitely check out the website. And if anything, give the office a call if you have those questions. Innovations Medical has locations in Dallas, Frisco, and in Fort Worth. Here's that number to call if you have those questions, concerns, you just want to talk to Dr. Johnson. Give him a call. It's 214-972-0353 or 817-873-2885 for more. You can also check out their new website at innovationsmedical.com.